Of course, we do not find dinosaurs like these beautiful ones you see in this picture here. We find bones, we find teeth. And these are artists' reconstructions of how the flesh would be draped over those bones based upon our best guesses of how that might be. But what we have are bones and teeth. And so you must learn a certain amount of anatomical terms, basically bone names, uh, to be able to study them. And if you look in this dinosaur book or any other dinosaur book, there are lots and lots of terms. There can be hundreds of different bone terms for individual bones and then pieces of bones, fragments of bones, groups of bones. But I've distilled it down to a small number. There's 25 of these things that you need to know. If you have and are using the textbook, remember it's entirely optional, you will find these in Appendix A. Otherwise, here they are here. And so if I've underlined them in the following slides, you need to know them. So first of all, not necessarily bone names, but orientation names. And I like this picture from your book because it has both this nice raptor dinosaur here as well as this human, this person, and she's off to work with her briefcase here. And it labels the parts or areas. So whenever I'm going to use the term anterior, I am talking about the head region. If I'm talking the posterior, that's the tail region. Whether you have a tail like the dinosaur or you don't have a tail, or you have a diminished coccyx as we do. The dorsal area is the top or the back area. So for you, your back is your dorsal area. And on this dinosaur in this orientation, it's the top area. The ventral area is the belly, the front or the underneath part. So your belly is part of the ventral area, and then the undercarriage, the belly here on this dinosaur is also ventral. We also use two terms to talk about orientation related to the body. There is proximal, and that means close to the body. And then there is distal. So distal things would be like your hand. Your hand is distal to your body, but your shoulder, where your arm bone, the ball fits into the socket in your shoulder, is proximal. You can describe that both for a whole limb. Your foot is distal and your hip ball is proximal, or you can describe it for any particular bone. So the way they've drawn it here, they've taken the long leg bone, the femur, and the proximal end is the ball that fits into the ball and socket of your hip. And the distal end is that area that touches and forms the upper part of the knee, the part in dinosaurs where Robert Plot labeled it as scrotum humanum. So you do need to know those terms both for the test and as just something I'm going to talk about. Just you have to be familiar with this vocabulary throughout the rest of our discussion here. We're going to talk about the forelimb, and we have several bones you need to worry about. You have the scapula, the humerus, but mostly the worry about the humerus and these other ones. The humerus is the long arm bone. That would be the bone that goes from the shoulder to the elbow. I should note that the scapula is the shoulder blade bone. You have that as well. And then you have the radius and ulna, and those are the two bones that extend from your elbow to your wrist. And then you have the carpals, which are the various bones that form your wrist bones. And notice I'm saying your because we have these same exact bones as well. Scapula, shoulder blade, humerus, your long arm bone from shoulder to elbow, radius ulna, your two bones that extend from your elbow to your wrist, and then your carpals and metacarpals, etc., that form the bones of your wrist and hand. For the hind limbs, we have the three hip bones, the ilium, ischium, pubis, and I will point out and make a great deal of effort to talk about the special nature of dinosaur ilia, ischia, and pubis for you. Very, very important. But for now, just recognize that those three bones are the bones of the hip area. The femur is your long leg bone, the bone that extends from your hip to your knee. It's one big long bone. It's usually the longest bone in the body. And then the tibia fibula are the two bones that extend from your knee down to your ankle. And then we have the tarsals, which are your ankle bones. And as before, then you'd have the metatarsals and phalanges. But I just need you to know the tarsals here. So, and then there, right there, tarsals, metatarsals, where we've expanded it. This is the astragalus calcaneum. That was the name of those things. You don't need to know those terms, but this is the specialized ankle that allows dinosaurs the extra support for both standing upright and evolving large bodies. The vertebra, the backbones, let's get rid of this first. The backbones, the set here, these are defined or described by their position. They are numbered, but for us here, we're just going to talk about them as where they are in the body. You have your cervical vertebrae, and these are the ones that form your neck. And clearly we have a few of these, but if you think about dinosaurs, well, this dinosaur has a few more, and then we're going to have some dinosaurs that have extremely long necks, and they're going to have many, many, many cervical vertebrae. The dorsal vertebrae are your vertebrae that are along your back, that extend from the base of the neck down to right above the hip area. You have sacral vertebrae, and these are the vertebrae that are above the hip, and sometimes they're fused with the hip, and sometimes they're fused into one big group, sometimes they're still separate. And then for organisms that have tails, like these dinosaurs, but also like your, kitties and puppies, those are the caudal vertebrae. And then the skulls. Skulls are extremely, extremely complex. You're looking at a skull of an Edmontosaurus. It's a duckbill type dinosaur. And that looks like a lot of words up there, but there's even far more that one has to know if you're going to be studying these things. But for us, I really just want you to understand a couple of these. The dentary is the lower jaw, the jawbone. We have that as well. Your lower jawbone is called your dentary. And the maxillary is the upper jawbone. So the maxillary is the bone that your upper teeth are in. You can have these dinosaurs have a bone, if there's a bone in front of it, so more distal from the body, you would call that a pre-maxillary or a pre-dentary. And then there's a whole bunch of other things. Another note here, kind of cut off, but you'll notice that this particular skull has lots of little holes in it. There's a hole for the eye, a hole for the nose, it said several other holes. These openings or holes in skulls are called fenestrae. And then just to show you, here's a completely different dinosaur, T-Rex, obviously. And look at all these other names: squamosal, jugal, maxillary, premax, lacrimal, postorbital, parietal. A lot of these terms just to show you how complex it can be. But again, I just want you to know the 25 words that are underlined in these previous slides and where they are from, what they represent. Okay?